Hello, I'm Felicity Cohen. I'm so excited to introduce you to my Wellness Warriors podcast. For over 20 years, I've been a passionate advocate for helping thousands of Australians find solutions to treating obesity and health-related complications through surgical intervention and holistic managed care. My podcast is dedicated to all the people, past, present and future, who have helped shape my journey and continue to inspire me to work consistently to achieve a healthier Australia in both adults and future generations. I hope you enjoy it. Good morning, Dr. Karen Coates. Thank you so much for joining me on my Wellness Warriors podcast. And it's an absolute pleasure to welcome you here. You've had the most incredible career here on the Gold Coast, spanning a number of years.
Yes.
And I'd just like to go back to when you were first a GP, and at what point in your career did you start to think about things that might not have been within the traditional scope of the normal general practitioner's lifestyle?
It goes way back to when I first started in general practice in a little country town called Queanbeyan in New South Wales. And I had a very, very standard general practice. At that stage I was doing obstetrics, I was delivering babies, I was attending the emergency at the local hospital, and it was very, very much mainstream. And I had a couple of incidents with patients where my mind was open to the possibility that there was other ways of doing some things that I just assumed was related to medication. And one in particular, a woman who came in and complained about the symptoms of bladder urgency, and I thought she had a urinary tract infection. So I sent off her urine, and when the results came across my doorstep, it confirmed what I suspected. She had a bacterial infection. On the bottom of the piece of paper of her results was a list of antibiotics that were guaranteed to cure her infection. And so I rang her up and I said to her, Lynn, you've got a bladder infection. When would you like to come and collect your prescription for antibiotics? And there was this pause on the end of the line, and she was a very, very brave woman who had the courage to say no to a doctor back then, and it didn't happen very often. No, thank you, Karen. Just needed to know that that's what I was dealing with. I'm off to my Chinese herbalist to manage the problem. And of course, my medical mind, my very, very mainstream mind thought, oh my gosh, that's a terrible decision here. And I knew I had to keep her safe from that decision, but I also had to respect her ability to choose. So I said to her, well, finally, and even though it wasn't, when you've finished curing your infection, can you please provide me with another sample of your urine so I can make sure that it's gone? How long do you think it's going to take you? And the reply came back, 2 to 3 weeks. So I thought to myself quietly, okay, all bets are on here. I forgot about Lynn for about 3 weeks, and then all of a sudden her urine container, her sample, reappeared in my office, and a little note from Lynn saying, here's my sample as promised, Dr. Karen, I feel fine. Anyway, so I took the lid off and had a sniff, because doctors do that to determine the health of the patient. Sent it off to the local pathologist, and when her result came back, it really started to rock my world and that mainstream approach to urinary tract infections, because in my mainstream model, in my mind, she had 3 options: take the antibiotics, guaranteed a cure; choose not to, and she would either live with the infection forever, or she'd be so sick with it that she'd be carted off to the local hospital and I'd be called to actually put that antibiotic through her vein. And what I had in front of me with that second sample of urine was a perfectly healthy sample with no sign of any infection. So she'd managed to do what I would describe back then as a medical miracle. And because I was so interested in how she did it, I rang her and congratulated her on her result and asked for the name and number of her Chinese herbalist, because I wanted to know what they'd done. And that basically started a conversation that went on for several years in that little country town called Queanbeyan. And I started to see that there was another way of doing things, short of reaching immediately for that prescription pad.
So that must have been that first trigger for you to start exploring the whole concept of integrative medicine. And I think when a lot of people think integrative medicine, what does that actually mean? And how are we working together with traditional mainstream medical practice, but also looking at incorporating other new modalities to try and treat patients?
I think what integrative medicine is it's choosing the best out of both worlds, but being mindful that as a medical doctor I have to stay in evidence, so I need to have evidence backing up my decision, for example, to treat mild to moderate depression with St John's wort, the herb, rather than Prozac. And my evidence is that there's a very, very well-designed study that says if I give a patient with mild to moderate depression the herb, I've got just as much chance of getting them feeling well and buoyant as I have prescribing the medication. And I probably do less harm by that first off approach. But I'm also mindful that there are some circumstances where you have to bypass the natural and go straight to the medication because that's the right decision for that particular clinical scenario and that person.
Can those things sometimes work in combination? So I'm thinking back to myself personally many years ago when Dr. James Reed used to work with us, and he was very involved with the Australian College of Environmental and Nutritional Medicine.
Yes.
He was fascinated in the obese patient population with urinary pyrrole disorder, and he used to treat a lot with all sorts of things, zinc and other kind of nutritional type approach to how he would treat patients. And at that time I was going through a really stressful period, and he said to me, I think you should start taking SAM-E. So he put me on that, and I'd never had any exposure to that before, and I found it really, really helpful in balancing my moods, in helping me cope with the stresses that I was dealing with at the time. So do you ever see, is there room for those kinds of treatments to also work in combination with something like Prozac? Are they ever prescribed together?
Absolutely, and I think it's important for the therapist, whether they be a trained naturopath or an integrative doctor, to know when medication is the right pathway, and to also know whether there are any interactions with natural products and pharmaceuticals. And I'm also constantly surprised at the power of natural medicine to actually provide the end result, the goods with that. When we're looking at how that fits into a mainstream medicine model, I think sometimes doctors forget about basic biochemistry. And basic biochemistry says if you're zinc deficient, if you're vitamin D deficient, then you're going to impact on your ability to make those beautiful hormones that support mood and reduce anxiety. So if you're not actually feeding your body and feeding your cells, then regardless of whether you choose the medicine or the herb, the medication or the herb, you're still not going to have optimal results at the end of the day. So in my world, I think it would be remiss of a mainstream doctor not to look for vitamin D deficiency, zinc deficiency and iron deficiency in a young woman presenting with mood disorder, because those three things have a powerful influence on their ability to make the serotonin, which is their happy hormone, for want of a better word.
So interesting. You know, I think there's a common misconception, especially in an overweight person when they're exploring how they're going to actually achieve a weight loss outcome with the pathway of surgical weight loss, for example, that they're all of a sudden going to be starved of nutrition. How am I going to be able to absorb successfully all the nutrients that I need to survive, to live well, and maybe eventually to have children post being an obese patient? And what they don't understand is that their absorption is already so compromised.
Yes.
And what we're starting to see here now in this clinic is the opportunity to use IV nutrient therapy as well to supplement and complement, but also for correction.
Yes.
There's a really strong, I think, argument to look at how do we support patients overall from that whole nutrient profile. What do you think about using things like IV nutrient therapy? Is that something that you feel is relevant and worth exploring further?
Yeah, I think you made a good point where we look at people who are struggling to maintain their body weight are often, even though they're not malnourished, they're micro-malnourished. So their macronutrients are fine, they've got plenty of protein, fat and carbs, but their ability to get those trace minerals in and absorbed and sufficient numbers to actually support everything that their body needs those micronutrients for is quite compromised. And I think that the role of whether it be oral supplements or IV supplements is basically you need to fill those nutritional gaps while you're working on diet, nutrition and absorption in order for the patient to actually get to their goal, whether that be weight loss or optimal wellness, it doesn't matter. So I'm all for IV nutrients if we can't get them through in that more sort of digestive nutritional way.
And it's so interesting that this impacts mood disorders or just stable mood and well-being, and that we can treat with things like zinc. What other kind of nutrition can we look at to help someone stabilise their mood? Yeah. So often in this patient population, there's depression and anxiety is so common. It's high.
Yeah. I think when you look at young women, you've got to look at iron and iron deficiency due to heavy periods, for example. Okay. Magnesium is another player, and when I start to look for magnesium deficiency, even in sort of traditional and conventional blood tests, I'm surprised at how often I find a low level of what we call red cell magnesium, and that is the test that actually tells me whether you've got enough magnesium in the cell where all the action is that then provides support for your body. So I think that those sorts of nutrients are really powerful given intravenously, because it almost like provides a kickstart for those biochemical pathways that people need to feel well and then get the motivation to look at, for example, at things like weight management. The other thing that we know of people who carry extra body fat is that they are mostly inflamed, more so than people who are carrying a normal body weight. And that inflammatory process will actually chew up more of the micronutrients. So their diet needs to provide more of those at a time when they're probably trying to calorie and food restrict, and therefore not even meeting their basic needs from the point of view of those micronutrients, the minerals and the vitamins.
I remember years ago you mentioned at a talk that I was at selenium. Yes. And how important selenium is in your diet. And I so remember this, stuck with me forever, that I should have 5 Brazil nuts and that they needed to be from Brazil because the soil is richer in selenium and we don't get enough of that here in our soil and how our produce, where it comes from, etc. Why was that such an important element, and why should we think about selenium as being important in our diets?
Most of the soils in Australia are selenium deficient and also boron deficient and a few other little trace minerals. But selenium, from the point of view of weight management, is a really important player for thyroid support. So even just a little notch down in your thyroid gland's ability to basically support a nice, efficient basal metabolism is going to put you on the back foot when we look at weight management and weight loss. So looking at things like your iodine levels, another trace mineral that's very, very commonly deficient in today's world, selenium levels and vitamin D, they're all players that not only support good health, but also thyroid support, which is your metabolic support.
And so interesting that you mentioned thyroid, because if I think back to just early conversations with patients 15 years ago compared to today, for example, the number of people that I speak to who tell me they have a thyroid condition, the diagnoses in under or active or hypothyroidism or Hashimoto's. I never used to hear the word Hashimoto's. 15 years ago it was rare. This is something that I hear all the time. It's so prevalent. Yeah. What do you think's given rise to such an increase in all of these thyroid and metabolic type conditions?
I think that the evidence doesn't really give us many answers to that question, but if I look at it sort of from a general concept point of view, I think that if we're not actually nourishing the thyroid cells of our body, our immune system is more likely to be attracted to an unhealthy thyroid cell, tag that as unhealthy and germ-like, and then attract your immune system to that cell in order to rid it from our body like it was a germ. And so we have this autoimmune almost epidemic in our society, and certainly that Hashimoto's, that inflammation of the thyroid gland leading to a destruction of the actual thyroid itself and an inability for it to produce its thyroid hormones is just on the rise. And I see it more commonly in women, and I'm seeing it more commonly now than I was a decade ago. So I think it's got a lot to do with not feeding the thyroid well. And some diets are a real problem with that, particularly with iodine. Anybody who's followed a paleo-style diet for a long period of time is almost certainly iodine deficient. And so that's one of those micronutrients that you really need to pay attention to if you're looking at a fairly restrictive diet long term, because all fad diets do have their macro and micronutrient deficiencies associated with them.
Yes, so important to move away from the whole concept of dieting at all, and especially from fad diets. And for us in the work that we're doing here every day, we're seeing people who've tried absolutely every diet you can possibly even imagine, which is sad, that they should actually go through all of that before reaching a point in time where they need to find something that is more stable, and will give them, a solution that's more long term. I think also for so many people, they think, okay, I've got maybe Hashimoto's or I've got type 2, but it's under control because I'm taking a pill, I'm on medication. Where do you think the trap is there, and how do we get people to understand that that's not a good place to stay in?
I think that there's a difference between optimal wellness from the point of view of how your body's behaving and what your blood test results show. And you can have the most perfect blood sugar results on the planet and still be at risk of those medical long-term complications of things like type 2 diabetes. And again, it gets down to those fundamentals of if you're not nourishing your body well, if you're not moving your body, then you're really not supporting your body on a genetic level. And that's where optimal wellness sits. So I see that a lot. And I think too, when you're looking at people who have been on calorie restricted diets for a very, very long period of time, that's one of the big flags with regard to a very slow basal metabolism, because your body doesn't know the difference between choosing not to eat in a day and there being no food in your environment for that day. So there are some people who are far more likely to be pushed into that drought, famine, war scenario where their body basically goes into that starvation mode in an effort to allow them to survive the famine that they believe their body to be in. And that sort of thing is a real problem when we look at long-term weight management. If long-term weight management is calorie restriction, and particularly if that calorie restriction then gives people micronutrient deficiencies that then become an internal stress that then drives that whole process of lower basal metabolism, which means you just don't burn as much calories in your day as you were when you were, say, in your teens and you didn't have a weight problem.
So interesting. You touched on pathology. Something that really has struck me in one of your presentations previously also was how to read a pathology report. I'm so interested to hear your definition and your take on, how we should actually interpret pathology, and what does that look like, and how do the pathology labs set that standard deviation, the norm, in terms of how that's read. Can you give us a bit of a rundown on your take on pathology?
For most of the nutrients, like your zinc, for example, and to a certain extent iron as well, the reference ranges that you see on your pathology paper are determined not by optimal wellness, but by population averages. And if we step back and say that I know from other studies that most people in Australia are zinc deficient, then when the laboratories take some people's blood that is coming into the laboratory on zinc reference testing day, they actually take that blood test away and actually do a zinc level on it. They then average out the zinc coming into the laboratory on zinc reference testing day, and that is the midpoint of those reference ranges. And then there's a mathematical equation of 2 standard deviations from the mean that determines the low and the high end of that reference range. But basically that reference range is being determined by people who are zinc deficient. And when I look back on what's happened, for example, to the zinc reference, way back when I started in this game in the 80s, the reference range that you would see on a piece of paper for your serum zinc would be 15 to 35. Now it's 9 to 19. So over the period of those couple of decades, the laboratories picked up the reference ranges and had to move them in order to put the averages and fit them in between those two reference markers on that piece of paper. So now what we find is that people who just creep into the reference range with a zinc, for example, of 10, back in 1982 would have been clearly zinc deficient when the low cut-off mark was 15, and they would have been told even by their mainstream doctor to take zinc supplements. Nowadays, if you creep in and you score 10, you're in the range, and then you might be that person whose blood is taken in years to come to define the average of the population, and then again that weight, that reference range is picked up and changed yet again. And we see that happening time and time again with these really important nutrients that determine long-term health and well-being.
So how do we challenge that? It poses so many questions, and it does create a problem for us. Yeah. So what do we do next?
I think when you're looking at things like well, certainly zinc, vitamin D, have a look at where the reference ranges are on your piece of paper, but make sure you're in the top 10% rather than the what I'd call the not dead yet end of the range, where, for example, with vitamin D, if you hit 40, which is the cutoff on a lot of reference ranges for vitamin D in Australia, if you hit 40, you're in range, but all that means is you probably won't get rickets, which is a terrible deformity of your bones. But unless, as a menopausal woman, you actually hit 75, you'll actually be losing bone density at a much greater and rapid rate than women who sit at 100 for their vitamin D. So when you're looking at optimal, there's a sweet spot in that reference range. You don't want too much, but you don't want too little. And you need to actually be a little bit more savvy about determining where optimal wellness lies with regard to these nutrients. And for vitamin D, in my world, unless you hit 90, and you stay somewhere between 90 and 150, you're really not supporting everything that you need vitamin D for in your body.
Thank you so much, and I think that's so relevant and a great lesson for all of us to be really mindful of how we interpret the pathology results,
yeah.
But to also take control of that and take some action and to explore it and to really think it through. Optimal well-being obviously being the one thing that all of us would like to achieve for longevity and living well.
I think the problem that we have, and having been a very, very mainstream medical doctor for a lot of my career, is that our job is to diagnose disease and to treat disease. We very rarely have the luxury of spending sufficient time to actually give the message of preventive medicine and lifestyle changes, as much as most GPs that I've ever spoken to would love to have that opportunity. It just doesn't fit into our medical model where we've got a waiting room full of people that have, coughs, colds, flus, asthma attacks, what have you, and we've got a time limit on how much time we can spend with each patient when there's a waiting room full of people and we're already an hour late. So I think that if you're looking at optimal wellness, it often doesn't find itself in a very, very busy, very conventional general practice. But having said that, if you have a cough, cold, flu, or you're acutely ill, that's the place to be. So it's a matter of choosing the right specialist for your needs. And if you want to look at wellness, you need to either source an integrative doctor who perhaps gives you 40 or 60 minutes of their time, or a naturopath, rather than expect your GP to be able to set aside that time to do that preventive health.
100% agree, and we're very lucky here. We've got two brilliant, awesome, amazing GPs, so very fortunate here in that context, and I think it is so important. So something else that you talk about a lot that I would really like to touch on are sleep, stress, and sugar. They're three of the evils, or three things that I think that we are all so impacted by. First of all, with sleep, I just wanted to highlight the fact that I see so many people with sleep apnea, undiagnosed sleep apnea, but without a recognised attitude that this is serious and dangerous. And I really want more people to understand the impact of what sleep apnea really can mean for them if they're not managing it. And I also see that with weight loss, we can impact sleep apnea and quality of sleep so significantly. And the other thing that I see in that is obviously it sets up a cycle of behaviour, you know, where I'm sleep deprived, I'm tired, I'm exhausted, I'm going to reach for high energy dense, calorie, foods, coffee, energy drinks, whatever that looks like, whatever evil that looks like, to just keep me energized throughout the day, and setting off a whole lot of other host of complications. So it goes hand in hand with the stress and the sugar.
Yeah, and it's a vicious cycle too. When you don't sleep well, you tend to choose the caffeine to get you through the morning and then to the evening. And with some people, and particularly those who have been dealt a poor genetic card with regard to caffeine metabolism, that one shot of espresso that they have at 9 o'clock in the morning can still be playing havoc with sleep 17 hours later, because they actually are very, very sluggish and poorly efficient at getting rid of the caffeine. And one of the other things that people don't realise is that dark chocolate, gram for gram, has a huge amount of caffeine in it. So it's not only calorie dense, it's also really, really high in caffeine. And if you look at my preferred option is the 70% dark, 100 grams of that is about 1.5 espressos worth of caffeine. So that can really impact on your ability to get a good quality sleep, and it's going to be worse in people who have inherited those sluggish genes. So your caffeine is a real sleep saboteur, and it's really important that if you're not sleeping well, you completely eliminate all sources of caffeine from your life until you've got that beautiful restorative sleep pattern happening. And there are so many strategies that you can do to support sleep, and herbal strategies as well, that I think it's important to actually focus on that and prioritise it. It's one of what I would call the 5 foundational pillars of wellbeing. So you've got nourishment, you've got movement, you've got stress management, you've got sleep, and then you've got minimising the toxins that you're exposed to in your life. And if you don't get all 5 of those pillars right, then you're not really going to hit that sort of last third of your life and be as well as you possibly can through into your 50s, 60s, 70s, 80s and beyond.
Yeah, absolutely. And I mean, for me, I like people to start thinking well beyond their 40s and 50s when they're talking to us, because I feel that a lot of people don't have that vision of where they're going to be at 70 plus early enough. Yeah. And that is critical.
We do that with our financial planning. But if you haven't got your health moving into your retirement, it doesn't matter how much money you've got, you're not going to optimally enjoy it, because you're going to be spending more time in doctors' waiting rooms than on the beach or at the golf club. So I think it's important for you to really start looking at health and health maintenance as early as possible. And I would like that to happen in the 20s, where young people, and I'm seeing more and more of that in my practice, are coming in and they're not accepting of that pharmaceutical model that perhaps their parents have fallen victim to, and they don't want to be put on blood pressure medication in their 40s and heart medication in their 50s and diabetic medication at an early age. They want to look at dodging those bullets of chronic disease, and the earlier you start to do that, the more successful you are. And I had an interesting, very, very early experience with what I would call an obesogenic environment. We know from studies on obesity that 70% of it is probably genetically determined, but, and there's a big but there, those genes become irrelevant unless you are put into an environment that creates obesity. And when I was 17, I went to live in the US as an exchange student for 12 months. And over that 12 months, I was as active as I was back here. I was doing competitive training and swimming. But at the end of my 12 months there, I had put on 14 kilos of weight. And even when I was pregnant with my 2 children, I have never hit that weight ever. It took me 6 months of not trying very hard when I came home to drop that weight. But it was because I came back to in Australia at that stage what was a pretty clean diet, and within my family it was a very clean diet that didn't involve high sugar, mostly high sugar, high fat and hellishly processed foods. So I think it doesn't really matter what your genetic tendencies are. Some people put into that high fat, high sugar, high processed food are going to put on weight quicker, but they will all put on weight given enough time in that diet that basically encourages obesity, encourages weight gain.
So is that the unfortunate trend that you've seen? You remember a life when in your family that eating clean was fairly normal?
Eating clean was what we did, and again it was so starkly in contrast to moving literally out of a meat and 3 veggies and dessert once a week if we were lucky into an American style diet where they had instant breakfast and Pop-Tarts which replaced any form of real food, and it was breakfast on the run, and your breakfast at school was provided free of charge at that time, and it was all high energy food. So I would have a salad, but on that salad I would have lashings of Thousand Island dressing, and that would probably have been half of my calorie intake when I look at what I was eating back home in Australia. So in retrospect, it doesn't surprise me one bit that I put on that weight despite being really physically active. But I've never had to struggle with weight management because I suppose I learnt those foundations of really good health and food choices from a young age.
That really confirms the saying that we hear a lot, that you can't out-train a bad diet.
Exactly right, and it's so true. And I see this with a lot of, well, certainly young women that have an incredibly good training and quite a balanced training program, and they move a lot, but they still struggle with their weight. And I think that somewhere along the line, that basal metabolic fire has been turned down a bit in those women. And unless they provide, healthy lifestyle strategies, they'll never actually achieve easy weight management without paying the price.
One of the other areas of health in women that you've done a lot of work in is young women with PCOS.
Yeah.
Obviously, we see a lot of metabolic diseases, and we do see a lot more PCOS, but often in combination with endometriosis and then down the line infertility and other issues as well. Tell me about your story and how you came to drive a program to support women with PCOS. It
probably came about because of my very personal experience with my daughter, who I diagnosed PCOS with at I think she was 14 or 15, and I had the diagnosis in my mind and then confirmed it when she was 18. So I started looking at options that didn't involve medication because I didn't want my daughter to go on medication at that age. And one of the mainstays of turning down those sets of genes that dictate and drive the PCOS picture in medicine is weight management and good health choices. And I think that one of the things that I encourage young women who have got a diagnosis of PCOS to do is to reframe that particular medical label and to look at what is potentially its genetic origins. And we know from looking at genomes of our very ancient women that are thousands of years old, that the PCOS set of genes existed very early in our human life. And so then we ask the question, well, why has it persisted over that huge number of decades and generations? And the answer to that is it conferred an advantage of survival at certain stages in our human existence. And when I look at those young women who have high androgens, high male hormones, and the ability to store fat very easily, they're basically the warrior women who, in times of long-term drought, famine and war, were the last women standing as strong women who weren't falling pregnant at bad environmental times, so that when good times happened, they were the ones that had the babies and passed their genes on to future generations. And I think that if we take that model and reframe PCOS as, okay, it was a really helpful set of genes to have back then, how can we apply that and change our lifestyle to suit a more obesogenic life that we have now? And that involves, again, a mindful approach to all of those pillars. Nourishment, very, very important with the processed foods to cut out any processed sugars with that. And for those women, it's a higher protein and lower carb, but not a no carb diet. We need our beautiful fruits and our berries, because if we don't have those beautiful sugars coming into our diet, we don't feed the good guys of our bowels, and that then sets off a domino of poor health that's related to gut. So PCOS is a very complex disorder, but the diet and weight management is probably the first layer that you need to cement in order to take control of those PCOS symptoms and truly maintain both health, well-being and fertility into later life.
Excellent, thank you so much. And I see so many of these women who struggle to fall pregnant, and many of them also due to their weight, they can't get onto IVF programs. Being able to help them is just such a joy. And it's it's wonderful to see them actually get good outcomes and to eventually be able to fall pregnant and have healthy pregnancies and carry to full term as well.
Yeah, exactly. And I think that holds true. I had one patient who I remember very well. She was a country woman, and she desperately wanted a child, but she weighed in at 180 kilo, and at that stage she was actually not allowed to have lap band surgery because of her weight. So she was told to go away and lose weight before they'd actually accept her on the program. Which
shocked.
Was really, really hard to
Wow.
bear. But I worked with her for 12 months, and we got 50 kilos off her, and she fell pregnant naturally. She had a natural conception when she was down, and certainly still a high-ish BMI, but she'd lost a significant amount of weight, which allowed her fertility to shine and then to conceive naturally. So it's a long-term work process when we're looking at PCOS in that circumstance.
Definitely. Do you have a preference for a certain style of eating? We know that the Mediterranean diet's a very popular way of eating, or a style of eating. Do you have a personal preference for something that you believe really encourages optimum well-being?
I think the first thing I would look at is, where is your ancestral heritage from? So an ancestral area of perhaps European and UK would be ideally suited to a Mediterranean diet, but I wouldn't be giving that advice to somebody who had an Asian background. They have a completely different traditional diet, and it's important to acknowledge that, because their genes are set up to deal with food in a different way, and their microbiome is quite different when you're looking at people who have basically originated from Asia versus UK versus South America. And I know that we've had some interesting time with South American dietitians who have come out and tried to basically increase legumes and beans to an Australian palate, and basically only cause distress, because the gut, our microbiome, is just not set up to deal with a high legume, high bean diet. So I think that's important, is to look at what your country of origin, looking ancestrally where you've come from, and to try and take the best of those sorts of approaches out of it. When we look at what diet is best, there's a lot of information on eat right for your genes rather than eat right for your blood type, if I can put it that way. So I think that the fact that most of us in Australia have an Anglo-Saxon origin, that Mediterranean style diet has huge evidence and research to say that that's a very, very anti-inflammatory, healthy diet to be on. If we're looking at general advice and very specific advice, I would ask people who want to manage their weight and optimise their nutrition to get out the old kitchen scales and to weigh up at least 650 grams of green vegetables a day, and make sure they eat that each day.
650 grams?
Correct.
That sounds like a lot.
It is, if you try and do it with lettuce. But if you add a little bit of your cabbage, your cauliflower, your broccoli, broccolini, your zucchini, those green foods, you can get there. but there's huge research that says that you will live longer, much longer, if you have that high vegetable intake, regardless of what else you put in your diet. One of the other things that I think is just general advice is that deep fried food should never be a part of a healthy diet. And we know that because regardless of whether you're genetically prone to inflammation, if you eat deep fried food today, your inflammatory markers that are measurable on a standard blood test are elevated not only for the hours after that meal, but for the next day and for the day after. So up to 48 hours we can actually measure inflammation markers that are elevated beyond their normal just because you had that deep fried bit of fish or that deep fried bit of chicken. The same food that's baked doesn't do that. So it really is a matter of, if you take home two things, increase your vegetables and very much steer clear of that deep fried food.
Amazing. And I think that's so interesting to note, country of origin, to really analyse best approach to food. When we look at what's happened in Southeast Asian populations and the introduction of a Western diet, even just looking at dairy, because they're so often dairy intolerant.
Correct.
And now we see this high incidence of type 2 diabetes in India, for example, many other Southeast Asian populations where the increase in type 2 diabetes alone is drastic. It's devastating to see that that's what's happened from the introduction of a Western diet. So maybe we all need to rethink looking at our country of origin and appropriate, nutrition.
Our natural diet. There was a study that came out last week on Tanzanians. So we've got an African population where the researchers actually went in and looked at chronic disease markers and chronic disease incidence in tribes that had a very, very natural existence. They were still growing their own food, eating a traditional diet and moving well. And their relatives that had moved to the city and by definition were starting to get into that processed food, fast food diet. And within 4 years of moving from village life to urban life, they had basically the same incidence of type 2 diabetics as we do in our urban life. So it's again a take-home message that it really doesn't matter what genes you're given. If you stick yourself into a highly processed obesogenic environment, you're going to suffer from those same lifestyle diseases like your type 2 diabetes, obesity, heart disease and cancer, regardless of whether your country of origin.
Amazing. And I mean, for me here, we're very big on prevention. We've touched on that earlier, and I think for us it starts with our children. We have a childhood obesity prevention program here, and I just think that is where we really need to work on making sure that the kids of the future are never going to end up here as our patients.
Yes.
So that's really important to us. I could sit and talk to you forever, Karen. Thank you so much for being here. My final question that I like to ask all of our guests, what does wellness mean to you?
Wellness means that regardless of your age, you're able to get out of bed, move your body the way you want to move it, regardless of disabilities, move your body the way you want to move it, and have a buoyant and optimistic approach to whatever lays ahead in your day, and to get up the next day and do exactly that. So I think that's it. If you can do all of those things today, it's just a matter of being mindful that you need to support your body a little bit more carefully as you age in order to continue to enjoy your day and get the most out of each and every day you have.
Functional fitness
and
well-being, being able to move well.
Exactly right.
So important. And what do you think are some of the barriers that people are dealing with right here and now in terms of having that notion of what functional fitness looks like for the future?
I think we do too much sitting, and I think it's a matter of finding not time to hit the gym, but time to move your body. And that can be just getting up and spending a minute walking around your office, or going outside and hitting the pavement for 5 minutes, huff and puff, turn around and come back in your lunch hour rather than eating your lunch at your computer desk. So it's taking the opportunity to move and apply it to your day so that you're functionally moving a lot more.
Oh, I love that. It's a huge occupational, I think, complication of sitting at a desk. That maybe, for me, I might get up and go and do my run in the morning, but not move enough through the day. So that's a really good lesson for us to learn from you.
Yep.
Thank you. Thank you so much for joining me today.
You're welcome, Felicity. It's been a pleasure.
Thank you. Thank you for joining the Wellness Warriors podcast. It's been a pleasure to have you online with us. If you enjoyed the series, please leave your review, subscribe and follow, and we look forward to sharing many more stories with you in the future.